This is the news in brief from the United Nations. Efforts to boost COVID-19 vaccine production should be matched by access to the syringes needed to inject them, and there could even be a global shortage of needles for regular immunisation campaigns next year, the World Health Organization (WHO) said on Tuesday. Based on a scenario where around 7 billion people need 2 doses of coronavirus vaccine between now and 2023, the UN Health Agency said that a shortage of at least 1 billion syringes could occur if manufacturing does not pick up. Lisa Hedman, WHO's senior advisor from the Access to Medicines and Health Products Division, warned that a generation of children might miss scheduled immunisation jabs unless manufacturers find a way to make more single-use disposable syringes. When you think about the magnitude of the number of injections being given to respond to the pandemic, this is not a place where we can afford shortcuts, shortages or anything short of full safety for patients and healthcare staff, the WHO expert said. She told journalists in Geneva that more than 6.8 billion doses of COVID-19 vaccines are being administered globally per year, which is nearly double the number of routine inoculations delivered annually.
A shortage of syringes is unfortunately a real possibility, and here's some more numbers. With the global manufacturing capacity of around 6 billion per year for immunization syringes, it's pretty clear that a deficit in 2022 of over 1 billion could happen if we continue with business as usual.
Ms. Hedman explained that reusing syringes even after they've been sterilised was not advised, as harmful bacteria remained present. She also noted that syringes were particularly prone to transport delays because they took up 10 times the space of a vaccine. To Ethiopia now, where UN humanitarians repeated their call on Tuesday for unimpeded aid access to communities caught up in the year-long escalating conflict in the north of the country. Across the country, some 20 million people need humanitarian assistance, including 7 million directly affected by the fighting in the north of the country, according to UN aid office OCHA. The development follows a warning from the UN's political chief to the Security Council on Monday that there was grave uncertainty surrounding the future of Ethiopia and for the stability of the wider Horn of Africa. Speaking in New York, Under-Secretary General for Political and Peacebuilding Affairs Rosemary DiCarlo noted that the risk of Ethiopia descending into widening civil war was only too real. In recent days, Tigrayan forces have advanced south towards Addis Ababa in coordination with the Oromo Liberation Army, Mr. DiCarlo said. In Geneva, UN humanitarians OCHA confirmed that the UN's top emergency relief official, Martin Griffiths, met Ethiopian Prime Minister Abiy Ahmed and de facto authorities in Tigray at the weekend. OCHA spokesperson Jens Lacher said that Mr. Griffiths had addressed challenges related to the suspension of humanitarian flights, the availability of fuel, cash and supplies, bureaucratic obstacles and humanitarian personnel.
In Tigray, he met our partners and engaged with the de facto authorities on the need for access and protection of civilians through all areas under their control and respect for humanitarian principles. He also met with women affected by the conflict, including survivors of sexual violence. Mr. Griffiths said that these women were desperately focused on daily survival, repeating their need for basic support such as food and medicine.
It is now 3 weeks since the last overland aid convoy reached Tigray, while 369 relief trucks remain held up in neighbouring Afar region, said OCHA's Mr. Lacher, who added that 100 trucks need to reach people in crisis every day. At least 11,000 people have fled violence in the Democratic Republic of the Congo, DRC, since last weekend, seeking shelter in neighbouring Uganda, the UN said on Tuesday. In an alert, UNHCR noted that this was the largest refugee influx into Uganda in a single day for more than a year, and that most of those who crossed the border were women and children. The development follows fighting between militia groups and national armed forces in North Kivu's Rutshuri territory. Witnesses reported fighting in the villages of Binja, Kinyarugwe and Chanzu. They were among many who fled with their cooking utensils, sleeping mats, clothing and livestock. Although Uganda's borders are closed to asylum seekers because of COVID-19 restrictions, UNHCR commended the authorities for granting a humanitarian exception and allowing safe passage to people seeking safety. But the UN agency expressed concerns that local capacity and services may soon be overwhelmed, adding that more resources are urgently needed to help the new arrivals. Daniel Johnson, UN News.